Good morning, everyone. We'll begin in just a few moments. Good morning. I'm Lindsay Goldfarb, Healthcare Education Program Manager at Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights Series webinar. MHA is excited to host this unique series, which will feature candid interviews of hospital leaders and will continue throughout 2021. Today's theme is pediatrics, people, and the pandemic. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please enter them into the chat feature. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I would like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's education program. In particular, I'd like to thank today's program sponsor, Marsh McLennan. A valued supporter of MHA, Marsh McLennan is advancing healthy societies everywhere, closing protection gaps, building climate resilience, and mitigating cyber risk for our interconnected digital world. Now I'll hand it over to Chris DeLaurie, Executive Vice President from Marsh McLennan, to say a few words. Chris, over to you.
Thank you, Lindsay. On behalf of the Marsh & McLennan companies, we are thrilled to be sponsoring this and other MHA events this year. Marsh has been working with several MHA members for years and have a national healthcare practice that currently includes over 680 clients. We assist hospitals, physician groups, and systems with employee benefit consulting, EACO development, risk management, liability, and captive strategies, and more. We're particularly interested in today's perspectives regarding DE&I and health equity assessments and gaps, as it has been a huge focus for many of our clients. We are especially grateful for the efforts of the MHA and especially you, the member hospitals, and your dedicated staff for getting us all through the last 15 months. You have all demonstrated why we are the healthcare capital of the US, and we all owe you a debt of gratitude. At this time, I am pleased to introduce our moderator for this morning, a great representative for your industry, Steve Walsh, President and CEO of the Massachusetts Health and Hospital Association. Steve, take it away.
Thank you very much, Chris. And thank you to your team. And thank you very much, Lindsay. And thanks to all of you for joining us this morning for our fourth Executive Insights session. As those of you who have seen the previous episodes know, the goal is to share some unique stories, journeys, perspectives, and personalities of our hospital leaders. In our first three episodes, we featured a leader from a large healthcare system, a community hospital, and a safety net provider. Today, we are pleased to be able to catch up with the leader of one of the world's foremost pediatric institutions. Since joining Boston Children's in 2013, Dr. Churchwell has played a key role in furthering the mission of the hospital, which is widely regarded as a model for children's hospitals everywhere. He has been instrumental in leading the hospital's work to become a high reliability organization, one where zero avoidable harm impacts any patient, any family member, or any employee. He's a tireless advocate for equity, diversity, and inclusivity. Dr. Churchwell is also responsible for establishing 3 of the 11 offices of health equity and inclusion at hospitals across the United States and Canada, including the office at Boston Children's, which he founded in 2016. With the publication of Boston Children's Declaration for Equity, Diversity, and Inclusivity in 2020, Dr. Churchwell is passionate about making Boston Children's and Massachusetts a community that's made stronger by our differences and a leader in equity for all. We're very fortunate that he's taken this experience to our MHA board, where he's co-chairing our standing committee on diversity, health equity, and inclusion. A graduate of MIT and Vanderbilt Medical School in Nashville, Dr. Churchwell completed his pediatric residency and a clinical fellowship in pediatric critical care at Boston Children's. He is currently an associate professor of pediatric anesthesia at Harvard Medical School, and Dr. Churchwell is the Robert and Dana Smith Associate Professor of Anesthesia at the Harvard Medical School. He is one of the most recognizable and trusted voices in Massachusetts healthcare. We are thrilled to have him with us this morning and to have him as the president-elect of our MHA Board of Trustees. Dr. Churchwell, thanks so much for joining us and welcome.
Steve, thank you. God, I just noticed I only have one suit.
Well, that may be changing in the coming months thanks to some of the recent announcements, right? First of all, you're just under 50 days in your new role at Boston Children's. How's this journey as CEO been so far, and what are the things that you've learned since you've taken on the responsibility?
Great question, Steve. Thank you, and it's a pleasure to be here today. The journey has been just fabulous, but that's was expected, to be honest with you, Steve, because I work with just wonderful people. I work with a collaboration of people that are truly dedicated to our mission of making sure that we are providing the best care that we possibly can for our children. And me helping them do that is something that I'm very excited about. So the first 50 days all in, and I'm looking forward to the next 50.
So you grew up in Nashville and you've been working in and out of this area for the last 3 decades. Why Boston? And more importantly, based on really what is your vocation now, why pediatric care?
Wow, we've only got like 20 minutes, right? But I actually came to Boston, Cambridge at the end of the 70s. And so I came here for undergrad at MIT. And so that's when I started my relationship with Boston. And so I've been here off and on since that time. I did my undergrad here and then returned to do my training as a physician at Boston Children's Hospital and spent over 8 years here. During that time, I met my wife and started to raise a family. And so we had a great relationship with Boston and great memories. And so we've sort of been back and forth over that period of time. And so when we had a chance to come back about 2013 to take over the role as EVP of Health Affairs and Chief Operating Officer at Boston Children's. We were very excited about that opportunity to come back to Boston. And so that's why we see it as our second home in terms of we've raised our kids here and we've had great relationships and opportunities. And so that's why Boston has sort of become our second home in that respect.
And Boston Children's, you certainly know my relationship with Boston Children's, and my twins turned 10 in March. And so, it has a special place in my heart, right? I lived over 100 days there.
Yes.
10 years ago, got to know the place well, walked around. I felt like Tom Hanks in the terminal. I knew everything that was going on. And you're there now and you see that life-saving every single day. Does that drive you? Does that impact you? What's so special about Boston Children's?
Well, I think that's the right description in terms of the impact that we have on our children and families. That drives me every day to think through how can we continue to provide what I can provide to the folks that are at the front line in terms of that care. Healthcare in Boston is just phenomenal, and we all know that. The COVID pandemic has shown that our adult colleagues have just done phenomenal work in just incredible circumstances. And it's just so exciting to be part of that milieu. Our part is the care of our kids. And our dedication is just profound from that standpoint. And for me to be part of that, for me to help us lead that effort is something that I appreciate, I respect, and I hope that I'm able to provide support as we move forward.
So I found your role in COVID fascinating because at the beginning, when COVID wasn't impacting children immediately, and we were seeing a lot of stuff happening in nursing homes and in other settings, your voice was so important because you weren't necessarily in it. And you were able to offer an incredible perspective and lead some of our CEOs. But children were not immune from COVID. What have you seen in pediatric care through COVID, and how did it impact your hospital as much as it did others over the course of the last 15 months?
Well, you're right. Children are not immune to COVID, but it is not a pediatric pandemic. Through these 18 months, 14, 18 months, we've seen some children with COVID, okay? And those kids are usually children who have chronic disease, who then get infected. At the peak of the pandemic, we had upwards of 10 to 15 children in the hospital for the initial COVID infection. And so that's not really comparing to what our adult colleagues were seeing. What we've also seen is a inflammatory syndrome that occurs about 2 weeks after an initial infection. Usually the kids that get this are asymptomatic, don't have any symptoms during their first infection, but then present what we call a multi-system inflammatory disease that looks like another disease that we are very familiar with, something called Kawasaki's disease. That's an inflammation of the vasculature. And with that, because it really mimics Kawasaki's, we had a pretty good view of how to take care of it, and have been very aggressive in the care of these kids who have inflammation of the vasculature. What I mean by that is they can have inflammation of their coronary arteries and other vasculature that can cause problems. But with aggressive treatment, we've been very successful in the care of these kids. We've seen close to 100 kids with that disease, and we will continue to see that as this pandemic continues. But that's been what we've seen. We are still looking around the corner, to be honest with you, Steve, in terms of these variants, in terms of how this vaccine can mutate, to make sure that it won't affect or is not affecting kids significantly. We keep knocking on wood from that standpoint, but that's what we've been seeing. We've also tried to, of course, as you've mentioned, be that support service for our adult colleagues, for the adult systems, by providing instruments, ventilators, by providing our people who have volunteered to help, to support, whether it's our respiratory therapists, our nurses, and our physicians, to make sure that we're all in this together. And we're all collaborating to do the best we can for everyone in the Commonwealth.
And you have been on many calls with the governor, the Secretary Sutter is talking about vaccines, and you know as well as anyone, we are 89% there with people over age 65. But what about in your facilities? Are kids and their families excited about the vaccine? Are you seeing hesitancy? How do you think this is going to play out over the next few months as we're trying to get vaccines into the arms of kids to make sure they can go back to a new normal, go back to education, go back to sports? What are you hearing in Boston Children's?
Right. So we're hearing, knock on wood, significant acceptance, willingness, and understanding of the importance of being vaccinated. We still are also seeing some vaccine hesitancy. And we've got to continue to work to overcome that, Steve. I see our way out of this is getting everyone vaccinated, everyone that we can get vaccinated. Because this virus is not unlike any virus that we've been taking care of. Something like this happens once in a millennium, and I'd rather not deal with it past this millennium. Because of the nature of this virus. So whatever we can do to educate, to support those that have vaccine hesitancy, convince them that it's important for everyone, especially our children, to get vaccinated. That's what we're pushing. That's what we're trying to do, to educate and be available, working with our primary care pediatricians as another example in terms of that education to get our kids vaccinated as we move forward.
So we know every study says people trust their doctor more than anything, right? You're my doctor today. I trust you. And obviously I trust Boston Children's with my relationship. My 12-year-old or my 11-year-old turns 12 May 28th. He's excited about getting the vaccine. And you're my doc. I say, hey, doc, that's fine, right? Have him get it. He should get the vaccine.
Absolutely. Absolutely. He should get vaccinated. And this is our way to get to, I can't say we're going to get to total normal, whatever normal was pre-COVID, but we need to get to our new normal. And that is our kids getting back to school, our businesses open, our activity. And part of that, the main part of that is getting vaccinated. We have this incredible opportunity through science, through investment, that we've created a vaccine in less than a year, which is just phenomenal. And we've got to utilize it to get to that new normal.
I want to switch gears a little because we've all been talking about COVID a lot, but there's other work that you are doing that frankly is generational. And it's something that is a family affair for you and your kids and your wife's involved. But I want to ask a question. Who's the Jackie Robinson of journalism? And how did that impact what you're doing today for people in the Commonwealth and around the country?
Well, thank you for that question. Actually, my father, who has passed, got the moniker as the Jackie Robinson of journalism. And the reason he received that moniker was that he was the first African-American to write for a daily Southern newspaper. So this is about 1950 that this started. And he wrote for a paper called the Nashville Banner, which was the evening paper in the city of Nashville, Tennessee, for over 30 years. As you can imagine, starting in 1950, that was a significant challenge. And at first, he did not want to do it because of the challenge of dealing with what he had to deal with. But his friends, his community really worked on him and said, hey, if you do this, you'll be the Jackie Robinson of journalism. And so that name stuck as he started his journey. So that's who the Jackie Robinson of journalism was. It was my father, Robert Churchwell.
And did that, and I think we're going to see a picture on the screen now. Did that help shape this particular team here? Who's up there now?
So those are my brothers. We have one other brother who's not there because he's not a physician, but those are my brothers.
It was a white coat only photo. We couldn't
have
it.
It was a white coat only photo. And included there is in the middle is one of our older brothers, Andre, an adult cardiologist, but now the vice chancellor, also the vice chancellor for diversity for Vanderbilt University. On the left is my twin brother, Keith Churchwell, Dr. Keith Churchwell, who he's an adult cardiologist, but also currently the president of Yale New Haven Hospital. And I'm on the right. I'm the one that has the correct tie on. That's a Children's Hospital tie on. And so I'm on the right there. And at the time, I was CEO of the Children's Hospital in Nashville at Vanderbilt Children's Hospital.
So is it fair to say that work to promote health equity, healthy communities, promoting public health are things that you really grew up doing? And so why does this time feel different? I mean, you're leading our Committee on Diversity, Health, Equity, and Inclusion, and you're making remarkable strides, changing a group that sometimes doesn't move as swiftly as we might like. What are you focused on? What are the goals, and how are you making that change to be permanent, and not just not just a minute in time, but a movement?
Well, thank you for that question, Steve. My view is that equity, diversity, and inclusivity is always important, has always been important. But what we have is a moment in time, moment in our history where it has gone to the forefront. And what I've tried to say is that we need to take advantage of that moment to really create long-lasting change in what we do in healthcare around equity, diversity, and inclusivity. What the MHA has done has been phenomenal because, Steve, with your leadership, you have said, this is important. We have to take this and move this forward and help our hospitals do this. And I thank you so much for that because it's given me the opportunity to be part of that change. And that change involves how we recruit, how we develop our workforce to make it a workforce that is more diverse, more inclusive, how we educate our boards and infuse our boards with diversity, how we continue to create an environment where health equity across the board is important, and we're addressing it. And those are just three of the topics, three of the issues that the MHA is working to support our hospitals in their journey. And I will tell you, our hospitals have taken the bid. They have truly decided that and realized the importance of this. And our goal is not to make this the flavor of the month, right? This is not Baskin Robbins, right? This is going to be something that has to be long lasting, has to change what we do every day for the good of everyone in the Commonwealth. So that's what we're trying to achieve in the work.
You know, there's a great Bobby Kennedy quote about a ripple that creates the tidal wave. What's the ripple? What if some folks that are looking at this, everyone's examining it now, people want to do the right thing. Are there basic initial steps that people can take to begin to make equity part of their everyday work?
Yeah, I believe so. And I believe one of those ripples is the decision to make it part of your conversation, that it's part of every conversation that you have in your important meetings at your board level, that the topic of equity, diversity, inclusivity is discussed around what goals you've created and what you're planning for, that it doesn't fall off the table. I think what I've said is that our success is predicated on, in a year from now, we're still talking about this. We're still continuing to have discussions about what the goals are. Our failure is that in 3 months, we're talking about something else and it's fallen off the table. So our ability to make it part of our conversation, part of our goal setting, just as important as what we're doing for volume growth or the next clinical program or the safety and quality aspects of what we're doing. It has to be part of our conversation moving forward. Our success, I think, is predicated on that.
And I've heard you talk about it, but just want you to reiterate, because you also believe it makes you a better hospital, provides better care, makes patients more comfortable, it makes kids see what they can become when they grow up, right? It is a part of everything that you do at Boston Children's, isn't it?
Absolutely, because, you know, as you walk into I like to say, as you walk into our lobby, you see the United Nations. You see families from all parts of the Commonwealth who come looking for care for their children. As you know, we are a children's hospital that is seen across not just our Commonwealth, but regionally, nationally, internationally. And with that, you see families from all aspects coming through. And what I believe is that in order for us to provide excellent care, we need to be representing that in terms of our workforce. For those families to see that we care, that they see them in us, I think is a great opportunity and is part of providing quality, excellent care. So that's one of our goals, to represent our families in our workforce as we move forward.
I have to say, your work is remarkable. It's simply extraordinary. And one of the things that I find so interesting and admirable is that you have embraced it. You said, I will lead. I won't wait to be asked. And in everything I do, in every organization I'm a part of, I will be intentional about it. And that's contagious. And so thank you on behalf of all of us for what you're doing. It is an effort that is incredibly important. And it's true and lasting change that you are making beyond all the lives that you save every day. It's saving lives. It's saving spirits in different ways. So keep up the great work. We're getting some questions in the chat. So I'm going to shift back here to COVID again, because obviously this is on the hearts and minds of parents as well. So parents of young kids. So the parents vaccinated, the young kids aren't, and they're starting to reemerge into the world. Can they go in stores? Can they go to museums? Can they do things? Should those younger kids stay masks for the foreseeable future? Are you offering guidance to parents that might be nervous that their kids are under 12 or under 6, hopefully in the next couple of weeks? What do we say to them?
Well, we continue to make sure that we're following the CDC guidelines. And as those guidelines evolve, we make sure that we educate as best we can our patients and families, our children, about what those guidelines are in terms of masking, in terms of getting out in the world. And so currently, greater than 12, the recommendation now is that vaccination, especially with the Pfizer vaccine, is the way to go. And we are recommending that. In terms of getting out in the world, I still believe that masking makes sense for multiple reasons. And the recommendation is masking and social distancing still works. And it's the basic thing that works, that has worked, that we will continue to do that. As that evolves, as the recommendations change, we will continue to educate and and evolve from that standpoint. I think that our children need to get out in the world with their families, with their patients, and the opportunity in terms of the summer, in terms of camps, school, all of those interactions are important. I know we can do that safely. I know that we can do that following the proper guidelines, that this can work. And that social interaction, I believe, is profoundly important. The isolation that we have seen has not been a good thing for our kids. And it goes to the issues that we've seen with behavioral and the mental health issues that we've seen. And so whatever we can do to decrease that isolation, to get our kids back to a normal part of activity, I think is important as we move forward.
Yeah, you touched on it, so I'll ask a quick follow-up on it. You know, we've talked about challenges with behavioral health being the epidemic within the pandemic. What are you seeing? It must be impacting kids. I mean, the isolation of the last year. How's your team dealing with some of the mental health challenges that COVID has created, and ones that were there before, frankly?
Yes, well, that's been the most difficult part. One of the most difficult parts of the pandemic for us. In that I say that our pandemic has truly been the behavioral and mental health issues that we've seen in our children. The number of children that we see every day that have been stressed, that are exhibiting these issues has been 2 to 3-fold that we usually see normally. And it's all traced, a lot of it's traced to what's happening in our society, what's happening with this pandemic in terms of the isolation that I've mentioned. It is something that we continue to work on. But I will tell you, Steve, we're working on catching up. And at some point, our work has to be to how do we get ahead of this? How do we figure out what is in the best interest of our kids in terms of this piece of work? And it involves not just the hospital, but it involves everyone. It involves working with our families. It involves working with our primary care pediatricians. It involves working with our school system and with the state in terms of getting a plan together that really supports our kids in this regard.
So the last year, you did an incredible job helping other hospitals, made staff available, you made equipment available. Then you were dealing with your own challenges in pediatrics, people that had deferred care, and now you're doing incredible work around equity. But what jazzes you about the future? We've looked back a little bit. As we close the half hour, what are you excited about that's going on at Boston Children's and the future of pediatric care? What are you getting up and going to work saying this is change that we can make for our patients?
Wow, gosh, do we have another hour, Steve?
You have all the time you want.
But what we're doing at Boston Children's is incredibly exciting because we continue to ask the question, why not? Why not? Why can't we take care of this disease? Why does this disease continue to be a disease that cuts short the lives of our children? And what can we do to ameliorate that, to provide a treatment, to provide a cure? And that's what our folks are all about, thinking through the what if and pointing that toward the future of the next evolution of care for our kids. And in doing that, we are providing leadership that is supported not just here, but around this nation in terms of our colleagues in pediatrics who look to us to continue to lead that effort of figuring out what's the next cure, what's the next opportunity for the care of our kids. As you know, we led the effort in the polio vaccine. We've led the effort in genetic therapy. We've led the effort in multiple surgical advancements for the care of our kids. And we continue to do that. And that's extremely exciting. I'm also excited about being part of how do we make our kids, how do we provide our kids in the Commonwealth the best future? And how do we work with all the different constituents in doing that? That's another opportunity that I think we have at Boston Children's.
Well, as we come to the end of our time here, Dr. Churchwell, I want to thank you. Not only are you personally inspiring, but the work that your team is doing at Boston Children's is as well. It truly is heroic, all that you and your team are accomplishing on a daily basis. Your leadership around pediatric care, diversity and inclusion, and so many other critical healthcare issues have strengthened our healthcare community in so many ways in the Commonwealth and throughout the country. So thank you for your time here this morning, and thank you for all that you are doing on behalf of our communities, on behalf of our patients.
Steve, thank you.
Thanks again to Marsh McLennan and all of our sponsors, to you, all of our attendees, for being part of today's Executive Insights series. MHA offers virtual programming like this every week of the year. We encourage you to visit our website for more information and to join us for our next episode, which will be on June 23rd. Thank you so much for joining us this morning, and have a great day. Thanks.